Well, good morning. Thanks for being here today. What a great crowd. Love to see everybody. This is going to be a fantastic presentation, and I suspect that's why you're here, so thanks for making time for it. I'm Holly Brenner. I recognize many familiar faces from our Friday mornings together, but I'm grateful to be here, and I'm glad you're with us. We'll start with a reflection. This is one that I borrowed from Ed Kartheiser, and I've used a few times. It's recently become my favorite, and I'm sure some of you have heard it before, but it bears repeating. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, fabulous? Actually, who are you not to be? You are a child of God. Your playing small does not serve the world. There is nothing enlightened about shrinking so that other people won't feel insecure around you. We are all meant to shine, as children do. We were born to make manifest the glory of God that is within us. It's not just in some of us, it's in everyone. And as we let our own light shine, we are unconsciously giving other people permission to do the same. As we are liberated from our own fear, our presence automatically liberates others. Thank you, Ed. All right, in front of you, we have a few familiar looking pieces. We have I have a lot of stuff up here today. We have a program coming up that Heather Sullivan has been instrumental in putting together. This is a program with Dr. Schaefer. He's got some new technology over in his area called Ultra Shape and Bella Shape, some fat-busting technology, as Heather calls it. So take a look at that. Next month, we have our cancer program with Dr. Pasek, and Lisa Michaels will be presenting. And Zone Open House is coming up next week, Monday, so that's interesting. There's some new technology there, the WellBeats streaming class program. That's really a neat thing, so check that out. Basically, it allows you to participate in a class with even if there's not an instructor. It's all computer-based. I understand that's pretty neat. Of course, the yellow comment cards, so please continue to fill those out. We make changes based on your feedback every session. And also the green door prize, if you're interested in winning a chance. Katie, what do we have today?
The Know and Go Big and towel.
Towel, awesome. All right. With that, I will introduce our presenters today. So we have, we like to refer to them as the Agnesian HealthCare Dynamic Duo. You know, it's Batman and Robin without the capes, maybe. But this dynamic duo certainly has a passion for serving individuals and families within our areas that we serve, and they serve them through the diagnosis and treatment of autism. We are so fortunate here to be able to have the Treffert Center, which is a testament to the great work, over 50 years worth of great work of Dr. Treffert, and he's internationally known, I think most of you know this, internationally known as a respected researcher in autism and savant syndrome. So it's remarkable to think that he's right here, and he lives in Fond du Lac. So we're very blessed. He's joined today by Dr. Matt Dow, who currently serves as the Director of Behavioral Health and Autism Services, and the two of them have worked hand in hand, along with many others, to create the Treffert Center as we know it today. And you can only imagine what the future for the Treffert Center holds. So please join me in welcoming Drs. Treffert and Dow.
Good morning, everybody.
Good morning. Top button.
Top button. All right. Wow.
Yeah.
Oh, I think that's going to be our little video. Is that true? Why don't we just go ahead and get that going?
Dr. Treffert's been part of Agnesian HealthCare and the community since 1962, but this was an opportunity where he and Matt Dow came forward with a clinical plan that was sustainable, that we felt we could take care of individuals that were vulnerable, that had these needs, that we could offer specialized services that no one else offered, and it was really a niche program for Agnesian HealthCare.
I have always felt that at some point I'd like to have a place that focuses on savant syndrome, and if it can be here, that to me is a splendid opportunity, and certainly a convenient one.
Agnesians, they just wanted to show the haircut. Tried to get them not to do the video. See, that much better. So, you know, as Holly was talking about it, the Treffert Center is really an amazing place that is really the story of Agnesian, starting with the nuns. Teachers, nurses, you know, passionate, giving, and really accepting of all. And that's really the legacy of Dr. Treffert, focusing on strengths, and certainly the legacy we hope for the Treffert Center. The story is pretty amazing how all of this happened, and I'll go into it in a little bit, but these are just some of the people that are currently involved. There are more, and there are all the people out here. You know, Jim Mugen has been outstanding, Steve Little, administrative staff, Bonnie. All of this required a pro forma, you would be surprised, right? There's a lot of moving parts for the Treffert Center, and so pulling together all of those resources to make a viable plan is really hard. And it's hard to kind of conceptualize and talk about what the Treffert Center is. We have 4 pieces. That's kind of the take home, right? We have the library, Dr. Treffert's work. We have an academy for all children. We have clinical services. And then we have center-based autism care. Those are our 4 key things, but they all work together like pieces of a puzzle. They fit. And so when you try to describe what the Treffert Center is, you can honestly say it's a lot of things. We're doing research, we're doing all kinds of things. And so if you think about what we have here, it's hard not to be spiritual and thinking about how did this all come together? How would Dr. Treffert live in Fond du Lac, Wisconsin and be an international expert on autism? How would Vivian Hazel call and say that she has an autism program that goes across the state that's looking for a new home, and Agnesian would be able to bring that on board in 3 months? How would you have Dr. Tom Fabricius, who wrote a book on autism and is a brilliant mathematician and wonderful family practice doc and an amazing research person? How would you have Tammy Langhoff, a nurse practitioner who came from Children's Hospital and does behavioral health care for our children? Joni Stein, actually, is Dr. Treffert's daughter. Turns out she's a librarian, medical librarian. So how do you have a medical librarian come and set up and start, and she would love to still be here with us, but needed for family reasons to return to Oklahoma, but she's still with us. And Vivian Hazel, you know. If you don't have a chance today, please make an opportunity to go chat with Viv. She is the child whisperer and is an amazing leader in terms of inclusiveness and care, and compassion, and relationship. Brian is the psychotherapist over there, but he was working with Viv for like ever as a line therapist, and now he has a master's in social work, and he's learning neurofeedback, and he is just a giant, a wonderful man, and doing great work. So Kim actually turns out to be also an instructor in Oshkosh for adaptive technology. Has a master's in special ed and helps us with the curriculum across all of these settings, getting her PCBA, and also working with the Early Start Denver model, an evidence-based model for autism that's relationship-based. Meg Putty, board-certified behavior analyst. Many behavior analysts are kind of traditional and focused on the discrete trial method, not all, but Meg bridges the gap and really brings with her a lot of leadership skills and the ability to really think about relationships and be evidence-based for us. And then Leah. Leah walked into a daycare that she had to get licensed with all of this stuff, rules and regulations, and then she had to bridge the gap between Agnesian and JCO and everything else, and so she did an outstanding job, and our site visit for certification had 0 citations, which is amazing, and she did a great job. And so now she's actually kind of helping us coordinate all of these diverse service lines. Jody actually turns out that she had actually run daycares before. And so she's done an outstanding job. So apparently we have to get kids to and from schools at times, you know. We didn't have a bus. Someone left it out of the pro forma. And so consultants lab, pharmacy, and John and the courtesy vans have all kicked in and helped us coordinate how we can do that. So everything that, you know, we think about this beautiful brochure and marketing, you know, Holly's team, Heather, Molly, Katie, all of the people, Shelley, that's writing, all the people that go into that, I mean, they had to listen to us. Me, I'm kind of rainbows and ponies, right? You know, it's like, oh, we can do this. They're like, yeah, Matt, but what's your message? Keep it short, right? And so all of the places, you know, Dana in cafeteria, you know, hey, Dana, we need to actually feed children, apparently. Okay, well, we do this and this, and it's just amazing for all of the different departments, you know. I just can't say thank you enough to everybody. And then we think about our teachers. Our teachers have bachelor's or associate's degrees. This is just amazing. And their dedication to all of the work that they do is, you know, stories after stories from the parents of how much they love all of them. And really it is one person that we haven't had a chance to introduce that's with Tammy is Heidi. And Heidi, I'm going to embarrass you and have you stand up because your picture's not on there. But Heidi's answering the phone at the Treffert Clinic. And so Heidi actually coordinates the care where occupational therapy, Emma, who comes with a mental health and sensory integration background, and Jennifer Mao, who's a speech-language person, helps out on the evaluations. We're actively recruiting for another speech-language pathologist. They're actually hospital-based, and then Tammy's clinic-based. And so Heidi's got 2 bags of money to kind of go from one place to the other and figure out what to do and handle all these calls. And then if someone walks in and wants to see Brian, well, that's Dahl & Associates Satellite Clinic. And so there's all these different pieces that are pulling together. And so one of the things that talks about this, and I was talking to Sue ahead of time, when we were approached by Viv and looked at that, I said, well, you know, they've got 70 people that they work with, and so Sue said, oh, how many employees? I said, you know, I didn't. So she said, how many FTEs? And I said 30. Well, about 30. Well, it turns out that an FTE is like combined. It was 100 people. So she and her team in HR not only did that, but now we had to put, with Peggy, all of our stuff online because we had people across the state that needed to do health stream. And so as you see the Treffert Center, and as you see the Agnesian interface between the center-based autism program, you're also seeing all these other programs coming together and being coordinated. And so really, the story was just amazing. Can you imagine a healthcare system being able to transition 100 employees, 73 families, and not lose a day of service or an employee? That's pretty amazing. And so we had this former daycare that has closed, and we had an opportunity. And so administration was very kind and supportive. The HR issues have been huge. Laura Deal actually to set up regular meetings with me. Poor Laura has to deal with that. But it is the case that we have this opportunity now to really expand our services. And Dr. Treffert, who I'm going to introduce in just a second, really has that ability to bring out the best in everybody. And Joni as well, his daughter. They're a loving, caring family, and you really get that sense when you come into the Treffert Center. It's a loving, caring place. It's really a unique place. And so if you'd like to have a tour, if you haven't seen it already, please just shoot Leah an email and we can arrange that for you or your department. So Dr. Treffert, it's your story, your house.
Thank you, Matt.
Gotcha.
Actually, I owe a great deal of debt to Matt because if anyone really put this place together, it was Matt who did all the work of all these pieces, and I have often said it should really be called the dollhouse. Let me start with a little bit of background here. Actually, I'm no newcomer to St. Agnes Hospital. I was born here in 1933. And in 1962, I moved our family here, and we've been in Fond du Lac since that time. And it was in 1962 that we started the psychiatric unit here at St. Agnes Hospital with Dr. Meisinger, some of you may remember. And then the adolescent unit and the AO unit all that while as well. So I've been involved with St. Agnes Hospital for a long time. And I really appreciate the opportunity to and am humbled by the opportunity to have a center named after me, but more importantly, to carry on the kind of work that I hope we will be able to accomplish. I grew up in Fond du Lac, went to medical school in Madison, and completed my psychiatric residency in Madison in 1962. I was assigned the responsibility of starting a children's unit at Winnebago Mental Health Institute, and here I am with one of our little guys. I haven't changed a bit, obviously. But it was on that unit that I met my first 3 savants. One little guy had memorized the bus system of the city of Milwaukee. Another little guy, you could put a 250-piece jigsaw puzzle face side down, and he had put it together just from the geometric shapes. And a third little guy was a master on what happened in this day in history. And every morning I'd come on the unit and he'd say, Dr. Treffert, do you know what happened in this day in history? I tried to bone up the night before. And that was in the days of the encyclopedia. There was no internet, but I could never do. So I got interested in the situation in which people with disabilities have some island of genius or extraordinary ability that stands in such stark contrast to the overall handicap, and that's called savant syndrome. I began to collect some cases and do some research at that time. I went on to be director of the hospital, and so I didn't have a lot of time then to spend with the savant work that I wanted to do. Being the superintendent of a mental hospital was a very interesting occupation, by the way. Very interesting happened one night. I was called back to the hospital. It was an emergency. I had to go back, and I was in my street clothes. I was walking from one building to another, and one of the patients came up to me and said, "Say," he said, "I haven't seen you here before. Who are you?" I said, "Well," I said, "I'm Dr. Treffert, and I run the hospital." He gave me a very knowing and a reassuring look, and he said, "Well," he said, "you'll get over that. I thought I was the governor when I..." So, in June of 1980, Leslie Lemke came to Fond du Lac to give a concert at Goodrich Little Theater. And I wasn't at the concert, but my daughter Jody was. And she came running home and said, "Dad, Dad, Dad," she said, "I just saw a miracle." I said, "What'd you see?" She said, "I saw this lad, he's developmentally disabled, he's blind, he has spasticity, which he can't even hold a spoon and fork, but if he goes to the piano, it disappears and he can play anything that he's ever heard. But he's never had a music lesson in his life." And I said, "Well, that is a miracle, but it's also called the savant syndrome." That story of that concert was picked up by the wire services that year, and Walter Cronkite used that as his Christmas story about May and her miracle son, Leslie. In 1983, 60 Minutes did a program in which Leslie was featured, and many of you probably don't remember it. You may not have been here at that time, but your folks, I bet, remember that program, because so many people remember Leslie from that program. It made him kind of an instant celebrity. And we started doing the circuit, the talk show circuit, all of the shows. He and I have been on Oprah 3 times, as a matter of fact. And I remember one time on Oprah, which was interesting. The producer said to me, we want to play something for him he's never heard, and we want him to play it back. And I said, "Yeah." And I said, "Just choose something short." Well, they chose Rhapsody in Blue. And so Leslie started, da-da-da-dum, da-da-da-da-da-da-dum. Break for commercial, da-da-da-dum. Come back from commercial, da-da-da-da-da-dum. And finally the producer was standing there praying, "Please let him stop." But he became very well known, and we had him here for a concert several years ago, and I hope to get him back here at least sometime in the spring, probably for a concert. I hope you'll attend, because he is an inspirational story. Of all the savants I've ever met, he's the one that has really touched me the most. About that same time, Barry Morrow was writing a script for the movie Rain Man. He had met Kim Peek. There I am with Kim and his dad, and Kim is the most intelligent, vastest memory person I've ever met in my life. He's the Mount Everest of memory. The story was inspired by Kim Peek, but the story is not about Kim Peek. But nevertheless, the movie Rain Man changed the whole face of how people understood autism and looked at autistic savants. I got a call one day from Hollywood saying, Dr. Treffert, would you mind looking at the script for Rain Man? And I said, I'm in Fond du Lac, Wisconsin. You're in Hollywood. How come you're calling me here? And they said, well, we want the movie to be accurate, and we want it to be sensitive. And we did make changes in the script, which I don't have time to talk about here, but and the movie did end up being very accurate and very sensitive, and really changed the whole nature of autism and made autistic savant household terms. Well, along the way, I decided to give up my private practice and concentrate more on research, and got in touch with Matt Dahl at Dahl & Associates because I know that he had a lot of data. And so we began working together on some research projects, and I was concerned, especially at that time, that the diagnosis of autism was being made too easily, and that we need to be sure we call things by the right names if we're going to treat them. The first step in treatment of any medical condition is to make the diagnosis, the correct diagnosis. So we began to be concerned about that. At the same time, Vivian came along with her program, and the hospital was kind enough to let us use the building that had been the daycare building. And of course, we jumped at that opportunity to do that. The center is a place that celebrates, supports, studies individual strengths and unique talents, offers strength-based multidisciplinary education, evaluation, treatment, research services, providing hope, help, and advocacy. Or as one mother wrote to me recently about it, she said, the place offers happiness and hope. And if ever there's a legacy for the Treffert Center, I hope it's happiness and hope. As you come into the building, you'll see this picture by Stephen Wiltshire. He's the savant that takes the helicopter over the city for 45 minutes and then spends the next 5 days drawing it window by window and brick by brick. And this is his rendering of Rome, 5 days over. And he was kind enough to allow us to have a print of that for the center. As Matt mentioned, one part of the center is the library. And as he mentioned also, my daughter is a librarian, and she was a little bit aghast at all the stuff I had in my basement over these 50 years and how disorganized it was. I'd get a call and I'd say, I know it's here somewhere, I just can't find it right now. And she said, we've got to organize this thing. And so she stayed with us for 8 months, as a matter of fact, helping put the library together. And she sends her regards, by the way, for those. She's a remarkable woman, and helped us put together the life and works, which means all the things that have ever been written about Savant syndrome, all the videos that have ever been made, and all the papers and other kinds of things that focus not just on Savant syndrome, but exceptional brain performance. And our current research focuses on Savant syndrome, acquired Savant syndrome, hyperlexia, and autism. And we're, as I said, just delighted to have a place to carry on that work. And that is sort of the background for my work. And I'm just so indebted to the hospital for having provided this opportunity, and I'm glad to have you here to learn what we're up to.
Thank you, Tom. So, Dr. T talked about the library and the research that we have opportunities to do there. The clinic. The clinic is more of the service lines, direct service lines. One of the things that we're challenged with is we have a reputation so far. It's kind of like an autism center. And it really isn't that. It's everything. It's all of us. 1 in 5 of us will have a mental health issue. If you think about friends, family, throughout the lifespan, that's probably going to be 100% of us. So when we're trying to sort who gets what service or what type of kid, it's really hard to find the right language because it's all of us. And so we have services, and we have expertise, and we have an amazing blessing to have the staff we have. The clinic brings together some of the direct service lines. And so we do evaluations, multidisciplinary evaluations, including OT, speech language, psychology. We can consult with our medical staff. We work with school districts. We gather a lot of data. The state requires a lot of data for the diagnosis of autism. But really, for a small child, and research is showing 18 months to 2 or 3 years, we really want to get that diagnosis. And so, you know, it's a lot like I would imagine it would be when you had a positive breast cancer screen, and then you have to wait. Well, everyone's telling you if you have a child that may have autism, you need to get an evaluation, and you need to get started soon. And so we're really committed to trying to make that happen. And we also have children that are identified later, and we evaluate them as well. And so when we bring in our team, it's play-based. So Kim does the ADOS, and OT does occupational therapy. A lot of the kids have sensory issues, you know, and if you think about what sensory issues are, they're all the things that go into your day-to-day. But for some of our kids, their overwiring is in their ears and hearing, or in the sense of touch or taste. And so imagine what the world would be like. We all probably do have our own sensory issues. We need to know what that is and how to help them with that and develop those skills. And so we want to focus on strengths because one of the things Dr. T is going to talk about is acquired savant. Acquired savants, when you get an injury and then suddenly you have these talents. That implies that it's in all of us. We all have strengths, whether we know them or not. And so if I have a report and I'm just kind of drilling down, and to some degree you have to in a medical model, identify the areas that are lacking or in areas of concern so that you can label and then get resources to try to help adjust to that. But it really needs to be so much more. You really want to bring out the best of everybody. And so that's, again, all of us. We all have that ability. And so we do evaluations. Tammy consults on medical, behavioral, and health issues. Tom is our medical director and oversees our work from that perspective. Occupational therapy, you know, it really works out pretty well. It's a lot of moving parts. So we do have services available. It turns out you can't just hang heavy stuff from a wood joist. Dan did a great job of putting together a beautiful facility, he and his team. IT has done an outstanding job. We have a Mondo board. You know, I mean, that's cool. We have a Mondo board, right? We can do stuff. But when we have this occupational therapy room, it's where everybody wants to be. It's got this giant indoor swing thing, you got hanging ropes, you got pads on the floor. It is awesome. And so Jennifer can, you know, do her speech language next to if she needs to. Emma can do her OT work. And then Brian's office and my office are right there when you walk in the door. So we have psychotherapy, we have occupational therapy, we have speech language, we have the opportunity to consult with medical expertise, and then we have a library and a school. We really have a great opportunity to integrate things for all of that. And so that's really where we're trying to do our very best. So that's what Tammy's office looks like. Pretty chill, you know. No major needles or scary stuff going on in there. The part I wanted to really stress today is the importance of play. And so I've always kind of wanted to do this anyway. And so I'm just gonna, these are really cool. I'd like the lights to turn down just because I want to check this out. Can you turn off the lights for a second? Oh, and Ripon and Waupun. I emailed quickly. You guys can use a latex glove if there's no latex allergies. You know, there's no toys or candy on the table or bubbles. That's really not here. Sorry, I didn't think about it until 4 this morning. So if you can try to get these going around the room. And I'll get them back here, get them to the back. So the importance of movement and play is, there we go. Yeah, watch the coffees. You gotta watch the coffees. There we go. Now feel conceived. Good, good. I get it. Tanner is one of our volunteers and does a great job for us over at the center. And so, so when you think about kids and movement and the opportunity, it really is in play. We have to teach 3 skills. 3 skills that predict successful outcome across health and across all the social, job, everything else. And those 3 skills are self-regulation. Very proud of all of you guys. I haven't heard or seen a top spin, and they're sitting right in front of you. You guys would have passed the marshmallow test. I would not have. I'd be sitting there spinning that bad boy, doing everything. Self-regulation is a skill that we teach every day, but parents need to know how to do it. Adults need to know how to do it. And so the things that we're teaching the kids are the same things that all of our kind of corporate consultants keep telling us to do. It's good quality care, it's good quality relationships. But about 60% of us have disturbed attachments, which means we didn't necessarily come from that social, emotional, nice, warm place. And so we need to be specific and teach the adults and the teachers and the care providers how to self-regulate. And so really that moment of deep breath. So if you would just put your hand on your chest and your hand on your belly and take a deep breath. And notice, did your chest go up and your stomach go in? Because we really want to push our stomachs out. We want to breathe from our diaphragm. So now I'd like you to try, if you can, breathe in through your nose and push your stomach out, like that balloon. And then as you breathe out through your mouth, your stomach goes down. In through your nose, stomach up. Out through your mouth, stomach down. And so diaphragmatic breathing is relatively easily taught. You can have kids with a little stuffed animal on the floor going up and down. There's a great Breathe Elmo. There's apps, Breathe to Relax. But teaching self-regulation, how to bring your arousal level down, because we also know that the second determinant of health outcome is trauma. Trauma. 68% of us, 2/3 of us have at least one. Of those 2/3, 84% have more. That, again, is all of us. And so what happens is the brain doesn't know how to calm back down again. And so then we do all these other behaviors that lead to negative health outcomes. So our wellness is teaching these skills. Our academy is about population health. It's good for everyone, all people, adults and kids. And that's the message I really want you to understand, is that we focus on strengths, Dr. Treffert, all of the services we provide, but we really have that expertise across this system. Our behavioral health department, our nutrition department, all of the resources we have with sleep, everything in Agnesian, and all of you, because that is really the key. Social emotional skills are what we call those soft skills, right? So we also consult with schools. Sarah Arnold does a great job with 4K programs around Fond du Lac. A good example, little kid, they were doing the who gets to clean the chalkboard, and so everybody's standing there and saying, okay, everybody with blue on, go sit down, and they do something else, and the group has to go sit down. And so it was between these 2 kids, right? And he didn't have the polka dots on his sneakers or something, whatever it was, and he just sat down and cried. Traditionally, what we would say is, ignore him. And then, when he's cried, we would say, okay, that's enough, go sit down. That's kind of how we'd handle it, right? What does he learn? How does he know what just happened? If I take the moment and I say, oh, dude, you're disappointed. That's what that is. You're disappointed because you thought you were going to be there, you were all so close, and then you didn't get to do that. I'm teaching social language. I'm teaching what is expected, how we can manage that. I'm coaching. That is a difference that doesn't traditionally exist. And that's something that all of our teachers know how to do. They get extensive training, not only with their degrees, but Sarah Arnold comes, Kim does in-services, Viv does in-services. We do a lot of hard work, and they're also cross-trained as line therapists, so they know how to deal with all these kids. They're like ninjas, man. They know everything. So we really have an amazing staff of teachers supporting all of our children. But all the things we're teaching are good for all kids. Empathy. That is actually the #1 predictor across all studies. Empathy. And if you think about it, when your scores go up for patient satisfaction, it is the case that it's your empathy. It's your connection with your patients, your clients. It's recognizing that they're in a difficult situation. You're asking before you're touching. You're talking about what's going to happen next. You're taking their perspective. Empathy. In our case, we do have kids that are getting center-based autism care. We do. And we have about the same mix as the public schools. We have the same mix as all the other daycares. We've got sneeches with stars. We've got sneeches without stars. For Dr. Zeus fans, we've got ones with 2 or 3 or 4 sneeches. We got all kinds of people. But that's true for all of us. And so when people say, well, I thought that was an autism center, you can say, yeah, they do that kind of work there, but they do work with every kid, all people, across the dimensions. And so, good story, right? So we have a little kid that doesn't have words yet. And we have another guy that's pretty quick and fast moving. I like him. He's with me. And then we have another guy coming in, kind of laid back, new guy. Well, my, we'll call him non-self-controlled guy, has the social skills to say, this is my buddy. He doesn't use his words, but he's okay. Right? Empathy, right there. We have another guy who has some sensory issues. They play dodgeball because we kept this whole room aside for just having that space for movement. They know that, and so he's got 2 bodyguards in front of him. Every game of dodgeball, protecting him. Empathy. And so having an integrated center, as all classrooms need to be, really allows us to create that opportunity to grow those skills. This is just to tell you that it's evidence-based. This is a model out of Yale. They've done a lot of research. They have done longitudinal studies. And the Department of Social Services in Connecticut has committed tens of millions of dollars to doing what I just described. And then I just couldn't resist. In all fairness, Molly had a great metaphor for us. We are new. We just moved in April, and we're working out some of the bugs and communication and things. So if you're aware of things we could do better, please let us know. But we're relaxing. We're kind of getting there. Her idea was that we needed to wear the dress and shoes for a bit before we picked out our earrings and lipstick. Which I thought was only fair. I do sports metaphors, I gotta, you know. So we've worn the dress for a while, we're wearing shoes, we think we got a good idea of what we want in the center. And so we're teaching yoga, right? We're working for all kids. So we have our kids here that are getting bored, end of the summer, right? A little tense with each other. So what did they do? Stephen Wiltshire. You watch the video of him being a little boy. You talk about what it would be like to have a little, you know, autism and not be able to connect to other kids. And so they all sit and listen and watch this video about Stephen Wiltshire and what he's capable of doing. You know what they decided to do next, pretty much on their own? Their own drawings. So over here, I'll kind of throw those around, try and pass them around. And they picked big paper, right? Like as Stephen did big paper. And that allows us to have another lesson and another talk about empathy, about individual talents and skills. It all becomes part of it. And so these great people are just some of our teachers. And then we have, you know, the center-based care. We purposely keep our census low, and 5 kids in the morning, 5 in the afternoon, come in with their line therapist and hang out in the classrooms. Because when they go to school, they're going to need to know how to do that. Many of our autism services are home-based, but the opportunity to be in a center. We have a family coming down from Green Bay, and they have a little guy, under 2, who's reading, hyperlexia. Dr. T will talk about that. And so one of the things that that hyperlexia is that, you know, possibility that there's autism, but also possibility that it might be something different. So he's coming down, and they knew he was an early reader. They did a Google search, and they found Dr. Treffert, and they're like, I don't care, wherever he is in the world, we're going to go find that guy. And then she's like, that was Fond du Lac. And I had a look, where's Fond du Lac? So they come down, and they can't say enough nice things about how wonderful their child who now has words, how wonderful the work that Viv and her team and Kim and the team are doing both at the center and with them out at Green Bay. So I'm going to turn it back to Dr. T to close the deal.
Thanks, Dan. So, to summarize things, the Treffert Center is the only Savant Institute in the whole world. There is no other place looking at Savant syndrome. And that's a good thing, because up until the time we started the center, the Savant Institute was in my basement in my home. And I would get a call from somebody in Pakistan who wanted to come to the Savant Institute, and they assumed they're going to walk into this mega place of some sort. They ring the doorbell, and you turn right at the refrigerator and left at the freezer, and there is the Savant Institute. But, and that's where all this stuff was that my daughter was so concerned about. At some point, I think she was afraid she would be left with all that stuff and what do you do with it, so let's get rid of it beforehand. And it is a call to action worldwide for research and collaboration. I'm certainly proud of the kind of research and reputation that we have for that research, but I'm most proud of what Matt has been talking about, is the quality of program for kids with special needs or not. And if there's any goal that I've had when I started the Children's Unit in Winnebago, was to put together a quality program for those kids. And in some ways, as I hear the kids running up and down the hall now outside the library, I'm back starting a children's unit like I did 50 years ago, and it feels good. I'm not as retired as I might be doing that, but I enjoy every minute of it. This is a picture of Matt and Temple Grandin. We have, Temple is a worldwide celebrity of great renown, and she was here this spring to give a lecture in conjunction with Agnesian and Marion. And at the end of the lecture, Matt said that he was going to give her a ride from here to Marion. And he said, top down or top up? And she said, I got a comb, top down. This is Jason Paget. He is an acquired savant. Jason was a kind of a school bum, didn't take school very seriously, he hated math, and got mugged one night and had a concussion. And suddenly saw these images that turned out to be fractals, which is a mathematical term, and he now is running around the country giving lectures on mathematics, never having had any of that knowledge before. He's coming to Fond du Lac on October 3rd. He'll be in this room, as a matter of fact, on October 3rd, and then that evening at the library talking about his story called Struck by Genius. And I've got about 70 cases now of acquired savants, some musicians, some artists, and people keep asking me, where do you have to bump your head in order to But I hope that you'll be able to join us for that presentation. And this is October 3rd here, we'll be talking about, and I'll be talking about the acquired savant and what I call in search of the Rayman within us all, because the acquired savant points toward the potential within us all. And the question is how to tap that without getting hit on the head or having a stroke. And that's where we're headed. Let me close with a note from Barry Morrow. Barry Morrow wrote a script for Rain Man. Actually, he had written 2 earlier television programs called Bill, where Mickey Rooney played someone who was developmentally disabled. And then he wrote Rain Man, and has become very interested in autistic savant. He and I have become good friends, and are working together on a project now called the Barry Morrow Rain Man Fund, which I hope will draw some or send some resources to us to even intensify our work, and especially to make a connection with China and their autism efforts. So Barry sent us a little note about the Treffert Center.
Hello there, everyone in Fond du Lac, Wisconsin. This is Barry Morrow with a shout out to Dr. Daryl Treffert, the Treffert Center, and all my good friends are doing such fabulous work there at the new center. Dr. Treffert and I became acquainted back in the late 1980s when we worked on a little movie called Rain Man. And of course, it brought wonderful international awareness to autism, savant syndrome, and related disorders. But it also spawned something more important, even than a movie, which is a grassroots effort on the part of, first of all, Dr. Treffert, his entire career, but also a small group that I have put together. We're calling ourselves the Rain Man Fund, Barry Morrow's Rain Man Fund, and it is attempting to bridge the gap between East and West, share knowledge about autism and related disorders. We'll be bringing Chinese doctors, therapists, social workers, families eventually to Wisconsin, to the Treffert Center, and they'll be going back to China and imparting their wisdom, their diagnostic treatment techniques, all the rest of it, until one day we have a superhighway between our countries, and families with autism are going to be helped in ways we can't imagine right now. So I'm so happy to be involved, to have a small part in this. Dr. Treffert, you're my man. Thank you so much from the beginning, and we'll take this torch as far as we can. And thank you all. See ya.
We've got a few minutes left for some questions or comments. Anybody have any questions about what we're doing or what we're up to? Yeah.
When you talk about research, what does that look like? Is it a weekly? Is it a monthly? Is it a yearly? Who's involved? Can you just give us a little taste of what that means?
Well, the Treffert Center and in the Treffert basement before that is sort of a clearinghouse for people who are interested in savant cases. And through the Medical Society website, I get emails daily saying I've got a son or daughter who wanting to hook up with some people who are interested in research. So I'm sort of a clearinghouse or coordinator of research of other people around the world. We're formally hooked up with Sussex University in London, doing a study on acquired savant syndrome and synesthesia. My hope is eventually that we'll be able to bring some of the savants here and do some imaging studies on them, although their savant syndrome is rather rare, so they're sort of scattered around the world. But I would say the majority of the research effort is coordinating kind of a worldwide interest. At the same time, Nat and I are doing some basic research of our own, looking at the question, for example, the age of the father in autism is a question that is raised, and we're looking at the age of the father in our clinic, where I have a sub-interest in hyperlexia, and that's another whole story. Children who read early or speak late are often misdiagnosed as autism, and we're trying to bring some clarity to that, and we finished recently looking at 162 cases of children who read early, trying to find, differentiate their autistic-like symptoms from autism. So we're doing some hands-on research, but a lot of it has to do with the coordination.
And both of those last two were through the IRB board here at Agnesian. I think we have high hopes of being able to, as Dr. Treffert said, expand on what we're already doing and learn more what works, what doesn't work, how can we do a better job of what we're doing. Dr. Tom has lots of ideas, as well as the rest of the research team. Brian actually did his master's work based on some data that Dr. T had already collected on hyperlexia. So just as you think about this, I want to make sure before we take another question, we don't really have a Treffert Center phone number on purpose because there's a lot of moving parts. So if you want services for OT, speech language at the Treffert Center, to meet with Tammy for a med consult or someone you know, there's the Treffert Clinic number. If you want to have a child enrolled in the academy, there's the Treffert Academy number. If you want to get a hold of Dr. T and crew, there's the Treffert Library number. And then if there's a need for autism services or mental health services, that all goes through the Don and Associates number because we have to do all of the due diligence of registering them as clients and taking care of a lot of other stuff. If I can clarify that.
One other thing I should mention is, I failed to, is that the Savant art collection, which through the years I've collected art of various kinds from savants. Some of it is painting, some of it is sculpture, some of it is cutouts and all sorts of different things. And so we have preserved that collection of savant art throughout the Institute, and you'll see the explanation about the art pieces. So if you want to look at some very spectacular and interesting art and something about the artist, you're welcome to tour at any time.
Other questions? So it's really clear. Treffert Center is what when you get asked? What's the Treffert Center? It's a lot of stuff, right? It's a lot of things. Is the Academy for all kids? Yes. Yes, for all kids. Can you access services for behavioral health, OT, speech language? Yes. Can you get center-based care? Well, yes, but we have to go through our Viv and crew. And our key person on that is Sarah Kaiser. Lisa Hall is here as well to help out. If you could just kind of all staff that are here come on up so people can just see you. I'd appreciate that. Dr. Tom, come on up. Heidi. And so there are no further questions. I just want to, yes, please.
Are these social groups just for kids that are already enrolled at the Academy?
Very good question. So Danelle has done an amazing job of getting our applications for the Academy and getting our website up, TreffertCenter.com. And we have Terry over in Journeys. And so right now we have some social skills groups that are open to everyone in the community. And so they can go to TreffertCenter.com and find the link. The current ones we have are for social skills. We have yoga. We have Legos. Well, we have an early reading group as well. And so you can just look, and those are always changing. We have a list of groups that we'll be offering. But for folks, yes, and we have a key leader on our Lego club. Tiana has done a great job as a volunteer helping us out.
I just want to underscore one thing that Matt has said, that there continues to be the perception in the community that the Treffert Center School is for kids who have special needs and autism. That's not the case. It is a school for everyone, and some of the youngsters there have special needs. And I think we need to get that message out more clearly, because I run into that all of the time. I'm glad of our reputation with autism, and we're working at that vigorously. But I think it needs to be clear that the school and our effort is not just for kids with special needs, and that we invite children for all of the reasons that Matt mentioned as to what we're trying to accomplish there. I'm going to introduce people.
Well, I think you all have seen. We have Tom, Viv, Jody, Sarah, Tammy, Lisa, Heidi, and Leah.
And you should all be up here too, because Matt did a great job saying how this is a family. So thank you.
Yes. I think we're good. You have some prizes to offer people?
We do, but first I'd like to just do one more round of applause. That was a
Yeah, I will be glad.
I didn't see anyone put the funny glasses on. Someone just put the funny glasses on. Did you? All right.
Patricia
Holshoe.
Holshoe, I was going to say that. That's great. Thank you. Thank you all for being here. Have a great weekend, and we'll see you next time.